Awareness regarding this subject is necessary to contain this upsurge. With great honor, I would now like to introduce you to our guest speaker, Dr. Shomik Ghosh. Dr. Ghosh, with over 30 years of professional experience, is the president of the New Kolkata Academy of Pediatricians. He is also the panel pediatrician of the West Bengal Commission for Protection of Child Rights and an active member of the IAP. He holds the EB membership in the West Bengal Academy of Pediatrics and is the organizing secretary of the National Adolescent Health Conference 2022. He is present today with us to talk about the new Omicron variant and discuss the precautions that are essential for children to take in order to remain safe and healthy. After this, we are going to carry out an interactive session during which parents can ask up their queries which may arise in their minds during the session. To commence the session, let's welcome Dr. Ghosh.
Uh, Thank you, Vedant. Thank you for those really wonderful words, and I'm really impressed with your grasp of the topic also. Just reflects on how well you've been trained in your school. Thank you so much, the MC Kejriwal Vidyapeeth management. I have to thank your chairperson, Mr. Kishan Kumar Kejriwal, your director, Mr. Neelkant Gupta, your principal, Mrs. Mallika Mukherjee, your headmaster, Mr. Bishwajit Mojumdar, and of course, Nikita Jha for having got in touch and for having organized this wonderful session where I get a chance to interact with almost 300 of you here. So I would very much want this particular session to be an interactive session. I am prepared to communicate with you in English, in Hindi, and in Bangla. So feel free to communicate it with whatever is comfortable for all of you. And I'll just begin with a few lines wherein anything that regarding the coronavirus, there has been quite a bit of information overload. And we have all reached a situation where we've learned how to counter the threat to a large extent, while we have tried to know the nature of the germ and the nature of the illnesses in the different waves. But what everyone must be aware is that we are still learning, right? Any germ, any illness, it takes a little while before you understand the genetic structure of that particular germ, why it affects a certain section of people, why it causes more symptoms in the elderly and in the immunocompromised than in the general population. Why is there a predominance of respiratory symptoms? Why is it that in some people we get a predominance of gastrointestinal symptoms? So all of these questions, they are yet to be answered fully. And still, I think so we have been very fortunate that our scientists, mind you, our scientists who work behind closed doors, never come into the limelight, who are decoding the genomic sequences of this particular germ and giving us all the input as to how best we can fight this particular pandemic. It is something that has really been heartwarming. As you all know, and I'm sure your school would have also been a participant to that, parts of the schools have reopened. We pediatricians have been very, very strong advocates of the fact that the pandemic while giving it its due importance, while maintaining the COVID protocols, we cannot afford to keep schools closed any further. There's going to be multiple questions that why were schools probably closed in the first place? Then what is it that has changed in the last 2 years that now we feel emboldened to open schools, and how safe it is for school children? So let us first get a small overview of the whole pandemic. As you all know, India started getting affected from somewhere in March 2020. And the first wave caught a lot of us unawares, but thankfully, it spared the children, neither in terms of infection nor in terms of mortality. It was only the elderly and the immunocompromised sections of the population, as we all know, they got affected, and it was scary. It was really, really scary because uh, you suddenly had a large number of deaths where, as doctors, we also were not fully prepared. We didn't know what was happening. And before we could even decipher, we lost a few of our near and dear ones. Uh, and this was something which could not be taken lightly. So, what was very clear right in the beginning was that mass congregations, wherever there is a huge gathering of people, that is where the virus was spreading. So, it was very clear right from the beginning that it was spreading through the airway. Even as I speak, if I am unmasked and if somebody is sitting in front of me, I run the risk of transmitting the virus to the next person. So if I'm having a cough, or if I'm sneezing, or if I am very, very unwell, I run a greater risk of transmitting the virus to another person. So the first wave threw up a lot of questions, and we lost quite a few of our near and dear ones. The second wave, which hit us sometime about a year later, sometime in April last year, saw us better prepared, but it showed that there was a small change in the subset of patients getting affected, the younger adults and some children who had completely escaped the first wave and were not affected at all in the first wave, now started getting affected. But at no point was the pediatric and the children's affection to such a great degree that it should, quote unquote, be called alarming. Next, there was the question that if the infection was, quote unquote, not alarming, then did the children play a role in being spreaders of the virus to the other vulnerable sections of the family? For example, if I have the virus and if my grandparents are staying with me, I may not, or I may or may not be carrying the virus. But if I have the potential to infect my grandparents, it would be something that can be quite disastrous for them. So that question really came up during the second wave. And the third wave, as Vedant so correctly pointed out, has been low in terms of mortality. It has been low in terms of morbidity. So the difference between mortality and morbidity simply means the duration of my illness. And that is something which in the third wave we have found to be much less as compared to the previous waves. But the larger numbers that are getting infected, even if 1% or 0.5% of these larger numbers become serious or require extra attention or require hospitalization, given the population of our country, it could overload our healthcare systems. So, which brings me to the very important lesson that this pandemic has taught us, and which has to percolate down to the very lowest levels, all schools and to the grassroots, and which is who are the ones who have successfully come out of the pandemic. And mind you, 90% plus people who have been affected, they have successfully come out of this pandemic. So, my friends, this is not a moment to despair. This is a moment for us to reflect back and realized that we were challenged. And that challenge has thrown up certain very, very important lessons for us as human beings. It has emphasized that all of us who have a good immunity, we will be able to overcome this challenge. And how do you develop a good immunity? You do not develop a good immunity by suddenly consuming a few vitamins and zinc and a few supplements. No, your immunity will develop if your lifestyle is proper. If you have a fixed wake up time, if you have a fixed sleep time, and your day is divided into constructive portions, which helps the body to work and exercise properly as well as get adequate amount of rest. So immune system, like any system, it needs its own stimulus. And that stimulus, one of the most important stimuli, is a routine and a disciplined lifestyle. The second stimulus, which is very essential and which applies across the population, is that we need to be having good nutritional habits too. Now, having good nutritional habits, having a good lifestyle, it might seem like a very vague term for everyone. So, what do we mean by that? So, good nutritional habit would mean having a breakfast at a fixed time, and it should contain essential proteins like eggs, like a glass of milk, like a katori of dal at any point in the whole day. For those who do not consume non-vegetarian food, they would probably be quite content to have a portion of soya milk for the whole day. So these would be giving you sufficient proteins. Our staple diet is rice here in Bengal, but there is every risk that you run of becoming overweight if you have an excess of carbohydrates. So it's best to have the staple diet in two different forms. If you're having rice, you have it for lunch, and say if you're having chapatis, you have that for dinner, or it could be vice versa. What I have to emphasize over here, and this is for all parents, is that green leafy vegetables and green salads, minimum खीरा and टमाटर, ये दोनों रहने चाहिए आपके दोनों মেজর মিলস में। আপনার দুটো যে মেজর খাবার লাঞ্চ এবং ডিনার, এটাতে কিন্তু আপনাকে সবুজ শাকসবজি এবং শসা and tomato salad, these have to be absolutely essential. If your child is fussy, if your child is going to be demanding more of proteins in the form of aloo, in the form of chicken and mutton and whatever, right? Okay, you've got to understand that all of it can only be given after you fulfill the basic dietary requirements. The final thing that I have to emphasize in the diet is obviously the fruits. And these seasonal fruits, as you all know very well, it is needed in a chewing form. You don't just extract the juice and give it to your child, because that just gives you the carbohydrates. Meethapan jitna hoga, we will have. If it's not meetha, we will add a chunk of sugar to that and have it. So that really doesn't help, because the fibers are what are very, very important. So just to summarize, that the biggest prevention that all of you can get from any major illness, the corona has come, it is gone, but the permanent lesson that everyone has to know is that we need to have a proper lifestyle with proper waking habits, a good 6 to 8 hours sleep at night. And just as I have elucidated the dietary habits, we must have them in our diet. The pandemic has also given us a lot of lessons in hand hygiene. Now, I'm sure, my dear friends, a lot of you must be getting this, it must be ringing in your ears, कि बेटा हाथ साफ रखो, हाथ धो लो, দেখো তুমি ওই হাতটা দিয়ে কিন্তু এই জিনিস ধরেছো, তারপরে এটা দিয়ে প্লিজ খেতে বসো না। So, this thing has been there. It has been there since centuries. It was told to me by my mother and father. It will be told to you by your parents, and you will be telling it to your children. But if you've seen what has happened in the coronavirus pandemic, it has had to be re-emphasized. It is something which should have been second nature for all of us, but हमको ये बताना पड़ा लोगों को कि भैया अपना हाथ पैर साफ रखो. Make sure your hand hygiene is perfect, and that will help in reducing the transmission of any communicable disease. And the third thing, which I'm sure a lot of you must be worrying about, because it involves a change in your natural lifestyle. See, getting a good sleep, eating a proper diet, having a good hand hygiene, these can come to us and we can continue with that. The question mark comes with masks. And how long are we going to be having these masks? The question mark comes as to which age group really needs the masks. As you might be very well aware of the Ministry of Health guidelines, that masks are probably the best prevention to the root of communication of this illness. So as long as we can wear masks, and we know of many cultural communities which actually have masks as their lifestyle. You talk of the Jain community, you talk of the Japanese who have fantastic hand hygiene, right? So there have been communities who have scientifically evaluated whatever is being recommended during the coronavirus pandemic, that it is an effective means of making sure that you reduce the transmissibility of the disease. So the masks are something that definitely have a role in making sure that we don't increase each other's viral load. I may inhale the germ, have a certain population of it, but whether I will be transmitting that load that I have within myself, with or without symptoms, to a person nearby, will be entirely dependent upon whether I am masked in the presence of other people or not. Now, here, let me also make it clear that there is no recommendation for children below 5 years to be masked. Now, obviously, this will raise a question that if it is so important in stopping transmission of disease, why is there no recommendation for children below 5 years? So there is a very scientific reason for that. As you all very well know, that the size of our lungs, it increases as we grow. So a newborn baby has a very, very small capacity lung. So it has to work faster in order to oxygenate the whole body. So if you look at a newborn baby, the baby breathes something like 40 to 50 times per minute. And as we grow older and our lung capacity increases, the lungs increase in size, the breathing rate tends to come down, and ultimately we adults, we are breathing at about 18 to 20 times a minute. So when you're breathing, just imagine if all of you who are present here, if you try to hyperventilate, that is breathe faster than normal, what is happening? Whatever is entering is also getting expelled faster. So because the breathing rate is higher in children, they will definitely be circulating whatever is taken in will be expelled much faster. And with this higher breathing rate, if you're going to put a mask over there, the person can become suffocated. Hence, because children have a higher breathing rate, we should not be suffocating them with a mask. Their respiratory clearance is much better than others. Now, before I open up the entire discussion to more questions, just a final word. So we've talked about a good lifestyle, a good diet, and a good hand hygiene. And we've also emphasized that how important it is for anyone more than 5 years. And here, obviously, I'm hinting at parents also to be masked, especially when they're in a gathering or in a group. The other thing, I think, let me pass it on to the open questions, but just a few words about vaccination. Now, obviously, there's a lot of hue and cry that despite vaccinations, people are getting infected, that despite vaccinations, I'm getting infected a second time. People who do not have, there are people who have succumbing to the coronavirus despite being vaccinated twice. So this is all there in the public domain. But what the public domain has to clearly understand is the purpose of vaccination. Now, vaccinations, mind you, whether you're giving a polio vaccine, or you're giving a tetanus vaccine, or you're giving a coronavirus vaccine, what does it do? It introduces the germ minus the toxin inside the human body. And it stimulates the immune system of the human body to recognize the germ and produce its antibodies. Now, this mechanism of immune response, it is primarily designed हमें तैयार रखने के लिए, हम निहत्ते ना रहें. We should be in a position that when this germ comes in large numbers, our basic defenses should be ready. And that is the purpose of a vaccination. So by no means will any vaccination ever claim that it's going to prevent infections 100%. But what the vaccinations will do is that they will create and prepare the first line of defense. जिससे कि ना by chance if tomorrow something enters very similar to the coronavirus. And why do I use the word very similar? Because you must have heard of the term mutations. So very fine differences of the structure, they are going to be taking place because the virus is a very small 4 nanometer particle. So it's very prone to external influences for the change of its shape and structure. But should something similar enter, we should be ready to plan our defenses. So that is the purpose of vaccination. Gradually, as we are building up on our stocks and as our research is telling us that different sections of the population are safe with regards to vaccinations, it is getting opened up. There are two things here. People might be wondering why it still hasn't come for the children, why initially the elderly people have been vaccinated or healthcare workers have been vaccinated. It is a question of triaging, of prioritizing what you have as supplies. Please remember, unlike any other country, the Indian administration has to deal with 1.4 billion Indians. It is a population which requires huge and very skillful management of human resources. Today, nearly 350 of you have joined to get some insight into this kind of, into the pandemic. Just think about how many millions are there who do not have the benefit of this insight. So for the government to also ensure compliance, कि मैं एक program roll out कर रहा हूँ, सभी इसमें participate करें, even that is going to take time. So please be patient. Please learn your basic lessons in improving your basic health and lifestyle. Inculcate the good habits of avoiding crowds, masking yourself properly if you're more than 5 years, and having a good hand hygiene, and try and maintain these for the rest of your lives, because it will help you in building up a basic immunity. So what we need to do now, I think so, is rather than me going on a monologue, is to initiate a dialogue, and I will request some questions, please, from the audience. So whoever is moderating, Nikita, I think
Yes.
if there's some questions in the chat box or the people
Yes,
have
Doctor.
raised hands, I think so it's best for us to get on with the question and answer session.
Sunita ma'am?
Yes, thank you, Nikita ma'am. Life shrinks or expands in proportion with one's courage. And Dr. Kosh, your words have really given us a lot of courage to move further in life and accept more challenges in future. So, Doctor, I have a few questions. I already have a few questions from some of the parents. The
Thank you.
first question, which I would like to put forward, is one of the parents have asked that what are the possible symptoms of Omicron in a child? How will she understand that the child is affected? So that is the first question a parent has asked you.
Very good question. Thank you so much for the question. So the Omicron is a variant of the coronavirus, as you all very well know. And as we have already discussed, it primarily affects the airways. So when it affects the airways, any germ that enters the airways, the body's defense mechanisms also kick in very soon. So you will begin with sneezing. Once the germ enters from the upper airway into the lower parts of the airway, you would have the cough bouts, right? So sneezing, coughing, watering from the nose, these would be the initial symptoms. Once the body's physical resistance is overcome by the germ, that is, it has escaped sneezing, it has escaped coughing, and it has entered the bloodstream, then the white blood cells come into play and they start killing the germ, releasing the toxins from the germ, and that gives rise to fever. So fever, cough, and cold are the basic ascents of most of the infections with the Omicron, like any other virus. Once this virus, starts circulating in the body and it enters the muscles, it causes muscle pain, body aches, headaches. Some specific symptoms seen in the earlier waves, like a loss of taste, a loss of smell, they really haven't been seen much with the Omicron variant. And because the Omicron tends to be localized more to the upper airways, the lung involvement with this particular variant and oxygen requirement with this particular variant is markedly less. Now, while we make these general rules, please remember that if your general health and general immune system is compromised, then there will be big holes through which the virus can cause more serious manifestations. So very important, starts with sneezing, coughing, then you have fever and body ache, headache, and then if you have a compromised immune system, you can have more serious manifestations.
Thank you, doctor. So if a child is suffering from common cold, then and if it is for a longer days, then we should take it as Omicron.
See, most of the Omicrons also are resolving in 3 to 4 days. All right. Okay. Now, from the public health point of view, it is important for us to identify the causative agent when there is a pandemic. Okay. Because we would want to arrest the spread by whatever means we can, whether it is by masking, or whether it is by vaccinations. So whether you have a cough and cold on day 1 or day 4 or day 5, the identification becomes very, very important, especially during a pandemic. But the manifestations will be very similar to a common cold. When this particular virus will no longer remain a pandemic, that is, affecting huge sections of the population, it will be another of the viruses that causes common cold and cough, like adenovirus, like respiratory syncytial virus, or the influenza virus.
Okay, thank you, doctor. Doctor, the next question is from another parent, and she wants to know that now is it safe to allow the children to play and socialize with others?
Yeah,
because children are also getting bored at home, parents.
Yeah. I mean, this is a very nice question, and let me just take everyone back to the developmental stages of a child. जब एक बच्चा जन्म लेता है, से बड़ो होच्छे, हैं, the first social contact for this child is the mother. So first 6 months, this child only with the mother, nutrition wise, emotional support wise, the mother is more than enough. Gradually, the social circle starts expanding, and the child is learning to recognize the other family members and is starting to smile back at them, is starting to focus on people who are interacting with the child. So all of this is happening when the child is still unable to sit, unable to stand, or even move. So the moment you're able to sit, stand, and move, what comes in? The exploratory nature of the child comes in. And this exploratory nature of the child, that leads to a lot of curiosity and leads to social interactions and language skills. That is the means of communication of other members of society. So a very important part of childhood development is peer play and social interaction. Now, both of these are needed not only for language and speech skills, but also for your social skills. So for the last 2 years, in a very unprecedented manner, there has been a halt to this. So I keep telling the parents of my patients that even if your child is not going to school, please make sure that you have someone from the neighborhood, someone from amongst your relatives or your friends with whom your child can play for 1 to 2 hours till the schools don't reopen. Because we cannot be sacrificing a developmental stage for the children. And when we talked about lifestyle, we now realize कि एक बच्चा जब स्कूल जाता है, যখন সে স্কুলে যায়, তার ন্যাচারালি এত অ্যাক্টিভিটিস হতে থাকে, সে দৌড়োয়, সে ছুটে বেড়ায়, সে স্কুল বাসের জন্য দৌড়চ্ছে, সে একটা টাইমের মধ্যে রেডি হচ্ছে, সে স্কুলে গিয়ে বন্ধুদের সাথে ঝগড়া করছে, মারপিট করছে, যাই করছে, there is an interaction, there is a human face to the development. So that human face to the development needed to be restored as soon as possible. And that is why we have asked for a reopening of schools. So it's perfectly safe and it's very essential. Coronavirus has come, it will go away. But the normal development of human beings, they have to be subscribed to. So definitely a big yes for mixing with other children.
Thank you, doctor. Thank you. Now, another question is a very interesting question from one of the parents.
Yes.
She's saying that we are telling the children to wash our hands. But now, you know, the children, they also love to use hand sanitizers. So how far do you think that these hand sanitizers will really help them? Because most of them are into, yes, mummy, thoda mujhe sanitizer de do, and they love to play with it. So
Yes.
just doctor, if you can guide us on this.
Yeah, sure. See,
Yes.
hand washing has its own benefits, because whenever you're hand washing, if you know the correct technique of hand washing, you are actually cleaning yourself from the fingers down to your elbow, right? So
Yes.
a proper hand washing is actually sanitizing fingers, palms, and the forearm right till the elbow. And this helps us in handling things with a certain degree of cleanliness. When you're using a alcohol rub, you are just basically sanitizing your palms and your fingers. Now, what we normally say is, when we are developing the habits for children, before they go to school, once they come back from school, yes, a proper hand washing is certainly recommended, because we would want to sanitize larger surface areas. But while you're at school, you've got to be practical. You cannot be interrupting the continuity of your classes or of the other activities of the child, and hence the immediate vicinity of the hands, that is the fingers and the palms, they should be cleaned. As far as it becoming a habit or an addiction, as you might be hinting at, everything depends upon how you're being disciplined and how you're being taught. Today, we are using this internet to interact with more than 350 parents and children. Now, this is the beneficial effect of the of the digital age. And this digital communication that we are having, even in this pandemic times, but we all know this also can be misused, right? So
Yes.
for everything, sanitizers can be misused, can become an object of play, sometimes can also be addicting, but it is up to us parents to understand and try and guide our children as to when it is needed and when it is not needed, right? Okay.
Thank you. Thank you, Doctor. Doctor, one more question. That is, some of the parents are asking that is it advisable to give them the influenza vaccine at this age?
Yes.
Because, yes.
Very good question, because see, the vaccination schedule always causes confusions amongst parents, because you have the government recommending a certain set, and then you have the IAP coming out with its recommendations. And the whole confusion comes because there are some vaccines which are given only through the government centers. And if you approach a private practitioner, he or she can give you a few other vaccines also. So what the important message which I would like to give everyone over here is that nobody discovers a vaccine just for fun, right? A vaccine is always discovered whenever an illness has the potential of causing death or disability. Even today, if I get affected with tetanus, no medical science in this earth can save me. If today I were to get affected with the polio virus, it is almost 100% sure that I would be paralyzed for life. So that is why vaccines are developed. So why is there such a rush for developing the COVID vaccine? So though we know that most of the cases are mild, we all have it at the back of our minds that what if we fall into that 1% who are becoming severe? तो उसके लिए we need some protection. तो वो protection हमें vaccines देती हैं, right? So with the flu also, my dear parents, please remember this flu vaccine was the cause of the last pandemic nearly 100 years back. It is mutated and it mutates every year. But what we know now as flu is actually a protection against swine flu. So swine flu, especially in children, can be quite devastating. So previously, because the stocks were limited, it used to be restricted to certain special sections of the population. But now, as we have understood that it has the potential, especially in children less than 5 years, of causing a serious illness, it's very important for everyone to understand that the government still hasn't made it available through the health centers or through the government chain. But it takes a while for the government. Like a lot of you would have received the pneumonia vaccine or the rotavirus vaccine from private centers. But now, since last year, all these vaccines are now available even in the government sectors. So there's no such thing as an optional vaccine. If it is available and if it is something that you can give on the recommendations of a proper pediatric organization like our Indian Academy of Pediatrics, then please go ahead and give it. Hence, there has been a recommendation from the Indian Academy of Pediatrics that all children below 5 years should be vaccinated against the influenza virus. Children more than 5 years, especially who are high risk, living in very congested cities, having immunocompromises, having special situations, those children will also need to get vaccinated. And the flu vaccine mutates every year, unfortunately. So one vaccine is only valid for a year. It has to be given every year.
Thank you, Doctor. We'll definitely keep in mind. One last question before I go on to the parents, we can spotlight them. That is, one of the parents has also asked that is traveling by train or flight safe for the children?
See, what you must understand is that the outcome of any illness is a direct consequence of the discipline that is imposed and of the discipline that is followed, right? Okay. you just, I mean, this is just to exemplify, nothing else. You take the case of Japan. We heard a lot of things about a lot of countries imposing lockdowns, restricting schools, closing schools. What happened in Japan? They are part of this world. They're so close to China geographically. They hardly had a lockdown. Why? Because their citizens practice civic discipline to an extent which is unimaginable in our country. So if you're going to be traveling by train, if you're going to be traveling by planes, that is public transport, it is only safe as long as the citizens discharge their responsibilities properly. That is, they are properly masked, they are maintaining a safe physical distance, and they are all maintaining good hand hygiene. And they're also taking the trouble of being very honest to themselves that if they have a fever, cough, and cold, they will not travel and they will isolate themselves. So we can make rules, hundreds and hundreds of rules, but if it is going to be perfectly safe, it will only be safe if we as citizens are responsible and we follow the rules that have been set.
Thank you, Doctor. Now, yes, parents of, yes, Monu ma'am, you can spotlight Daksh Kothari of
Yes, ma'am.
class 4C. Daksh Kothari of,
Yes,
yes,
please go
sir,
ahead.
you can unmute yourself, sir, and you can ask a question. Dr. Isse. Yes, sir.
Good morning, sir. I want to ask which type of mask is essential for both children and parents?
Okay, for children, very clear-cut instructions, no masks below 5 years. Anybody more than 5 years will need a mask. Type of masks, a simple surgical mask is enough for day-to-day activities. But if you are going to be involved in any activity where for a prolonged time you will have mass exposure, yeah, community exposure, wahan pe possibly an N95 mask gives you better protection, right?
Thank you, sir.
Next, we have Shriyam Das of KGA.
Yes, ma'am.
Monu ma'am, Shriyam Das of KGA.
Yes, ma'am.
Please go ahead.
Yes, ma'am, you can unmute yourself and ask.
Good morning, ma'am. Good morning, sir.
Good morning.
Good morning.
বলছি আমি বাংলায় বলি
হ্যাঁ নিশ্চয়ই, প্লিজ
definitely.
প্লিজ প্লিজ বলুন।
স্যার আপনার কথা সত্যি ভীষণ ভালো লাগলো আপনি যেগুলো বললেন সেগুলো সবই আমরা সবই করছি কিন্তু তার মধ্যেও আমার ছেলের এই দুদিন ধরে একটু সর্দি কাশি হয়েছে তো আমি ওকে বাসক পাতার রস আদার রস এসব সকালে দিচ্ছি যেরকম সকালে দেয় মেডিসিনও দিচ্ছি সর্দিটা একটু কমেওছে কিন্তু ওর না খুব ইচিং হয়েছে এটাও কি ওমিক্রনের কোনো লক্ষণ স্যার?
দেখুন একটা ভাইরাস যখন আমার শরীরে ঢুকবে, হ্যাঁ, প্রাথমিকভাবে সেটা শ্বাসনালী দিয়ে হয়তো ঢুকছে, কিন্তু একটা স্টেজের পর ওটা কিন্তু রক্তের মধ্যে দিয়ে সারা শরীরে একটা সঞ্চালন হতে থাকে। এবার যদি স্কিনের নিচে গিয়ে খুব বেশি কনসেন্ট্রেশনের জীবাণু জমে সেখানে একটু অ্যালার্জি বা চুলকানি হতে পারে, কিন্তু মোটামুটি যেগুলো সর্দি কাশির ওষুধ হয় সেগুলো কিন্তু এই চুলকানি গুলোকেও যথেষ্ট কন্ট্রোল করে। হ্যাঁ, কাজে একটা কোনো ওষুধ যে কোনো একটা যেটা আপনি নিচ্ছেন ওর সর্দির জন্য আলাদাভাবে কিছু করার দরকার নেই, আপনি সেটাকেই কন্টিনিউ করবেন। অ্যালার্জির দিক থেকে একমাত্র যদি দেখেন যে প্রচন্ড শ্বাসকষ্ট হচ্ছে,
না শ্বাসকষ্ট হচ্ছে
তখন আপনি ডক্টরের কাছে নিয়ে যাবেন, আদারওয়াইজ যা চলছে তাই দিয়ে কন্ট্রোল।
আচ্ছা স্যার আরেকটা কোয়েশ্চেন ছিল, ওর তো ইচিং হচ্ছে এখন একটু, তাহলে আমি ওকে প্রত্যেকদিন রাত্রে সর্ষের তেল মাখিয়ে দিই পায়ের নিচে, তো এখন মাখাবো না তো?
দিদি দেখুন, বাচ্চাদের তেল ম্যাসাজটা নিয়ে অনেক রকম চর্চা, অনেক রকম গবেষণা হয়েছে। যদি আপনার বাচ্চাকে তেল ম্যাসাজ করতে হয়, বেস্ট অয়েল হচ্ছে নারকেল তেল। ঠিক আছে,
নারকেল তেল,
হ্যাঁ।
ওকে
সব থেকে কম অ্যালার্জি হয়, স্কিনে যদি ক্র্যাকস হয় বা ফেটে যায় তাহলে সেক্ষেত্রে নারকেল তেলই কিন্তু সব থেকে ভালো স্কিনটাকে রিপেয়ারও করে। ঠিক আছে, ওকে।
আসলে ও
সুনিতা,
এত দুরন্ত তো সারাদিন খেলতে থাকে, আমি ভাবি ওর হাত
বাচ্চা
পা ব্যথা
দুরন্ত না
করবে।
হলে,
না না, আমি
বাচ্চা
চাই ও
দুরন্ত
দুরন্ত
না হলে
হোক,
খুব মুশকিল
আমি
কিন্তু।
চাই ও দুরন্ত হোক, ও সারাদিন
হ্যাঁ,
একটু ছোটাছুটি করে, আমি ভাবি যে ওকে যদি রাত্রেবেলা একটু তেল লাগিয়ে দিই ওর একটু রিলিফ হবে, তার জন্যই আমি তেলটা লাগাই। তো
আপনি
সর্ষের
আপনি
তেল বাদ
আপনার
দিয়ে
মায়ের,
এখন নারকোল।
হ্যাঁ, আপনি আপনার মায়ের দায়িত্ব পূরণ করছেন, আপনার ভালোবাসা দিচ্ছেন আপনার বাচ্চাকে, আপনার স্পর্শ দিয়ে, সেইটুকু পেলেই হবে। কোন রকমের তেল তার উপর নির্ভর করবে না,
আচ্ছা,
আপনি নারকেল তেলটা ইউজ করুন, ঠিক
ওকে
আছে?
ওকে, থ্যাংক ইউ স্যার, থ্যাংক ইউ, ভীষণ ভালো লাগলো আপনার সেশনটা,
থ্যাংক
থ্যাংক
ইউ,
ইউ সো
থ্যাংক
মাচ স্যার।
सुनीता मैम, मैं
ধন্যবাদ।
सुनीता मैम मैं थोड़ा बात करूंगा, एक मिनट। हाँ,
Yes, sir.
डॉक्टर
Yes,
साहब
sir.
नमस्कार,
Definitely.
केजरीवाल
नमस्कार, बोलिए।
मॉर्निंग
कैसे हैं
सर।
सर?
Good morning.
गुड मॉर्निंग
डॉक्टर
सर।
साहब, मैं आपसे रिक्वेस्ट करूंगा,
हाँ जी।
हमारे यहाँ अभी 300 सवा 300 बच्चे और पेरेंट्स मैंने सब अब इसमें जूम में ज्वाइन
हाँ,
किए हुए हैं।
हाँ जी।
मैं आपको ये बोलूंगा, बच्चे अभी स्कूल आने चालू हो रहे हैं, ठीक है? इसके अंदर आप उनको 3 या 4 टिप दे दीजिए कि उनको घर से निकलने से घर में जाने तक क्या क्या चीज की उनको सावधानी बरतनी चाहिए। आप जो बोलेंगे वो सिर्फ मान लेंगे, उनके पेरेंट्स भी मान लेंगे, और हम लोग का काम थोड़ा इजी हो जाएगा।
नमस्कार जी। देखिए, बोलना आसान है पर छड़ी
हाँ।
घुमाना भी उतना ही डिफिकल्ट है।
पक्की
तो
बात।
तो सबसे जो इम्पोर्टेंट बात है कि जो आपने कहा, इसमें सबसे बड़ी बात जो है, इट इज नॉट फॉर द चिल्ड्रन। देखिए, मैं एक बच्चे को कोई चीज समझाता हूँ, अभी उसमें वो सेरेब्रल मैच्योरिटी नहीं आई है कि क्यों ये बोला जा रहा है। मैं एक बच्चे को बोलूंगा तुम उंगली मत चूसना, अपना नाखून मत खाना, वो आदत से करते रहते हैं, ऐसा नहीं कि वो जानबूझ के करते हैं। But you will generally not find an adult person doing the same thing. So why is there this difference? The difference is because of the cerebral maturity. तो बच्चों में सबसे बड़ी बात होती है कि वो अपने रोल मॉडल्स को देख के सीखते हैं, ठीक है? ओके, तो हमें जो भी इंस्ट्रक्शंस देना है, दैट इज फॉर माय डियर पेरेंट्स, दैट देखिए, आप ही अपने बच्चे के हीरो हैं, ठीक है? आपको देख के ही आपके बच्चे अच्छी आदतें सीखेंगे। तो जो भी हमने चर्चा की अबाउट मेंटेनिंग गुड हैंड हाइजीन, अबाउट मेंटेनिंग एडिक्वेट डिस्टेंसिंग, about not getting into too many crowded areas, तो ये चीजें जो, see, as the administrator of a school, सभी लोगों का एक इंटरेस्ट है कि आप सबको स्वस्थ रखें, तो इसलिए वो सावधानी बरतने की आपको बात करते हैं। तो जो भी सावधानियां हैं, वो एक ये है कि साफ सुथरा करके बच्चे को स्कूल भेजिए, उसकी अपनी जो खाना है, टिफिन है, जो पुष्टि है, उसको जैसे हमने आज डिस्कस किया, उसमें साग सब्जी रहने दीजिए, उसमें थोड़े फल रहने दीजिए, तो वो बच्चे के आहार को स्वादिष्ट भी बनाएगा और उसमें पुष्टि भी रखेगा। मेक श्योर कि आपका बच्चा पानी पीने की आदत में हो। ठंड के जाड़े के मौसम में बहुत वक्त ऐसा होता है, अदरवाइज भी बच्चे पूरा वाटर बॉटल लेके वापस आ जाते हैं। सो दीज आर हैबिट्स व्हिच हैव टू बी इनकलकेटेड, सिर्फ अभी के लिए नहीं, भविष्य के लिए भी। और सबसे बड़ी बात है कि अगर मैं अपने बच्चे को बोल रहा हूँ कि बेटा तू थोड़ा भाग दौड़ कर, तू थोड़ा एक्सरसाइज कर, वो तो सीधा देखेगा कि मम्मी क्या कर रही है और पापा क्या कर रहे हैं। अगर उसने देखा कि मम्मी होते होते पापा जी अपना न्यूज़पेपर लेके बैठे हैं, मम्मी सीरियल देखने बैठ गई है, they will have no motivation of engaging in activity. अगर बच्चे बड़े शार्प होते हैं, सब के सब बच्चे, and I'm saying this in an open forum, please don't underestimate the intelligence of a child. The commonest cases that we get of children being defiant of parents, invariably we find that habit that the parents are resenting is उनके अंदर भी है, ठीक है? वो देखते रहते हैं कि हमको मम्मी कह रही है हाथ धोने, पर पापा इधर न्यूज़पेपर भी पकड़ के फिर अपना ब्रेकफास्ट खाने बैठ जा रहे हैं। उधर क्या हो रहा है? दे आर receiving objects from the Amazon delivery person and also just keeping it on the table and then having their food. तो इस हालत में ये जो actions will always speak louder than words. तो आप लोग जो सावधानी आप सबको मालूम है, जिसकी समझ है आपको एज अ पेरेंट, एज एन इवॉल्व्ड एडल्ट, वो आपको बच्चे को आदत डलवानी है। Don't get frustrated if your child is not following your instructions. We don't expect them also, okay? Because उनकी उम्र ही वो, आप अपने बारे में सोचिए ना, आप जब 5 साल के थे या 10 साल के थे या 15 साल के थे, you couldn't have followed everything that your parents told you. But the repetition itself, अगर consistently हमारी तरफ से होती रही, सावधानी हमने बरती, then I'm sure the children will also follow that.
Thank you, sir. Thank you very much, sir.
My pleasure.
Thank you, sir. So parents, we have tried to, take in as many questions as we could. And we promise you that next time again, we'll try to have such session in which we'll again have the doctor, we'll invite him and he will give us more, insights about what we should do.
Sunita ma'am, our director sir is also present. So if you can unmute
Yes,
sir, if sir
sure.
would like to say anything.
Sure. So, sir, we are really obliged that we have a director, sir, with us. So, sir, if you could just tell us as to how you like the program today.
Good morning, everybody. Good morning, Dr. Ghosh. It was such a
Good
pleasure
morning.
listening to you. I mean, your presentation was so lucid and we really appreciated it. And sir, since I've got this opportunity to communicate with you, if I may ask a
Please, Mr.
question.
Gupta, please go ahead.
You just now mentioned, if when, for example, delivery is, it comes from Amazon and, the parcel or the packet is kept on the table. Now, I just wanted to ask you about this, doctor. These days, many people are ordering things home, whether it's groceries, whether it's food. So do these objects carry the risk of or run the risk of carrying the virus with it? Or, what should we do? Should they be sanitized? Some people say that you should keep it outside for some time, or, and likewise for clothes. I mean, can clothes be carriers of the virus? There seems to be some kind of confusion about this. So I was just thinking, sir, if you could throw some light on this.
Very lovely question, please. Thank you for this because it needs clarification. Let me be very categorical that there is as yet no evidence, and the word is as yet no evidence of surface to surface transmission. मतलब मैं एक चीज को हाथ लगा रहा हूँ, वहां पे वायरस विराजमान है, वहां से it is going to get inside me. This has not been scientifically proven.
Okay.
Right. Okay. But what is also to be very, very carefully understood is that this virus, it is defying a lot of logic. एक तरह से हम अपना we set out a few rules, we do vaccinations, we ask people to mask up, and it still manages to find its way inside the human body with each mutation. So we all know that live virus and dead virus, they have different potencies. All right, okay. So the entire thing is maine chika, and this virus has come onto my laptop surface. Wahan pe kitni der zinda hai? As of now, the evidence is it doesn't remain alive.
Okay.
You never know. And what we are trying to inculcate is to shut out all the possible doors as well as inculcate a proper hygiene. तो आपकी ग्रोसरी अगर बाहर से आ रही है, आप पहले भी तो उसको धो के फिर उसकी कुकिंग करते थे. If you are getting a clothing from outside also, I mean, my mother used to always wash it, iron it, and then make sure that I have it. Okay. So these habits will not harm anybody.
Yeah.
They may or may not be important as far as prevention of this particular illness is concerned.
Yeah.
As of now, they don't prevent, but if a mutant in the future is going to be surface transmitted, you're already ready with your defenses. So you just inculcate a good habit in your children by following these methods.
Yeah. Thank you, doctor. Thank you for that clarification.
Thank you.
And finally, sir, I'd like to say, I mean, our deep gratitude to you. You gave up your
My
Sunday
pleasure.
morning to
No.
enlighten
My
all of
pleasure.
us.
My pleasure.
I mean,
Part of
it's
our
kind
social
souls
duty.
and heroes like you that keep this country going. So thank you so much.
Everyone,
And we look forward to interacting with you again, sir.
My pleasure.
Thank you, and God bless you. God bless
Thank
everyone.
you.
Thanks a lot.
Everyone.
Thank you, sir. Thank you, sir. As Sir has just said, that words are not enough to thank you for the strength, courage, and dedication that you have given, and also the way you have motivated us. So now we can be ready to open up our schools. And parents have also got the message about what we can do. So now I would like to call upon Chayan to give the vote of thanks. Yes, Chayan, it's over to you.
Thank you, ma'am. A very warm morning to the August gathering. It's my privilege to propose a vote of thanks speech and acknowledge the contribution of our frontline warriors in retaining our lives from the pandemic. I take this opportunity to express my heartfelt gratitude to Dr. Shomik Ghosh sir for sparing his valuable time and gracing the occasion. Your presence in our midst will be cherished in our hearts for years to come. Thank you so much, sir, for your bravery, your sacrifices, and your unflagging compassion. Frontline warriors are heroes, and we won't be able to get through this time without you. Thank you, sir, for your time and hard work you have put into helping others during this insane time. Thank you for being a ray of hope for so many families going through the difficulties of COVID-19. You are an inspiration to all of us from around the country. I would like to thank our chairman, Sir Shri Kishan Kumar Kejriwal ji, for his relentless support and enthusiasm in helping us reach the zenith. Thank you, sir. Next, I would like to thank our director, Sir Mr. Neelkant Gupta, who has been a guiding light in our life and the success that we have achieved. Thank you, sir. My sincere thanks goes to our revered principal, Mrs. Malika Mukherjee, ma'am, for her constant support and guidance. Thank you, ma'am. I express my heartfelt gratefulness to our headmaster, Mr. Biswajit Majumdar, sir, who has always been inspiring us and boosting our spirits on many occasions. I would also like to thank our teachers for displaying unwavering faith in us. They not only help us realize our potential, but also have given us an unending opportunities to express the same. I would also like to thank the technical department for their constant support. On this occasion, I feel privileged to thank all the world's frontline warriors on behalf of all of us in retaining our lives from the pandemic. With this, I end up my words by expressing my honest and sincere gratitude to Dr. Shomik Ghosh sir and all the dignitaries, parents, and everyone present over here for their kind support, love, and affection. Last but not the least, a big thank you to each one of you who made this session a grand success. Thank you.
Jane, you're awesome.
Thank you.
Thank you,
Have
sir.
a good day, everyone.
Yeah.
Thank you.
Thank you, sir.
Be
Thank you, sir.
safe,
Thank you, everybody.
everyone.